Hello and welcome to the Mansuri Show. I'm your host, ARY Mansuri, and we are privileged to have four esteemed doctors with us today. Each is very prominent professional in their respective fields. So I would begin by inviting each of my distinguished panelists to please introduce yourself. Please share your name, your field of expertise, and anything else you would like the audience to know in about a minute's time. Thank you. I would begin with you.
Thank you, Mr. Arif Mansuri Saab. My name is Dr. Yasmin Qasim, and I graduated from Dow Medical College, Karachi, Pakistan, and practicing pathology in Southern California for the last 20 years. And I'm also a president for local chapter Apna. This is my second term that elected again this January. I'm a president of Sabah Homes, an orphanage organization for boys and girls in Pakistan. I covered almost 20 years. I supported Human Development Foundation, almost 12 years, in fact. And now I'm done with Human Development Foundation. I have other things to do.
Please.
Assalamu alaikum, Mr. Mansuri. My name is Halima Tasneem Shahabuddin. I'm a general pediatrician. I have been practicing in Southern California for the last 30 years. And initially I was working in Fontana. For the last year or so, I have moved to work in Covina, and now I'm working more part-time. I also graduated from Dow Medical College and then moved here after I got married.
Thank you.
Good morning. Thank you. My name is Dr. Azhar Majid. I'm a board certified internist. I've been practicing for over 20 years here in LA County and Pomona Valley area, general internal medicine and hospital medicine, and appreciate the opportunity to be on the panel today. Thank you.
Thank you.
Mr. Arif Mansuri, thanks for having me in your show. My name is Dr. Syed Ramanuddin, and I also graduated from Dow Medical College, Karachi, Pakistan. And I have been trained in different universities in Boston and in Chicago, but my primary specialty is cancer radiology. And I do a lot of academic research work as well, which include training of the patient and also doing the clinical trials and also for the early detection.
Thank you very much. You know, we certainly have the leading specialists in their respective fields here. The topic of our discussion today is living well, tips for healthy life. So before we dive into our topic today, I'd like to take this opportunity to thank Dr. Yasmin Qasim and her husband, Mr. Feroz Qasim, for graciously hosting this panel at their beautiful home. And also congratulations, Dr. Yasmin Qasim, for becoming the president of the local chapter of Apna. I would begin by asking you, you are a pathologist, you are a specialist in diagnosing disease. How important is regular health screening, and what are some of the tests that people often overlook?
Mr. Mansuri, the main thing for the patients is go regular checkup with their doctors because that's how they do an early detection of their health condition, monitoring their blood sugar, blood pressure, cholesterol levels, heart disease, and also it's very important for the patients to tell their doctor about their family history of their any cancer, any heart disease, any diabetes, because that's how they monitor him and do the early detection of their problems. So I think it's very important for the person to go regularly and do a checkup, and they watch their diets. Nutrition is very important. Physical activity is very important. Your mental health being is very important.
Thank you so much. Dr. Halima Shahabuddin, you're a pediatrician. So with the child obesity rates on the rise, how important is the nutrition and the physical activity for a child's future health?
The both are very important. And we have seen the obesity in children rise up to 30% in US. Other countries are also following, but in America it's the worst. But recently they said it has kind of plateaued. And of course, it is related to the nutrition and the activity. We have seen the changes in that the glycemic index, the high sugar content in the foods, the drinks, all sugar related drinks, sodas, and as well as the portion sizes have increased. That is making it harder to lose weight or not gain weight as much, as well as the advent of the social media or the electronic gadgets that have decreased the physical activity. I would say even the now you see with the Amazon, you don't even have to go there. They bring it to your house. So all those things are making it harder and harder for the kids to lose weight or not gain weight as much. And then they also do not, and also it's because of the new construction, it's not very friendly for walking or do go play outside for the kids. So that is all contributing to that. And then also decreasing the family time with the dinner at, both parents are busy, or all the parents are busy with their own phones and social media. So I think that is making and decreasing the home cooked meals, because it's very easy now with the foods that you can buy.
Of course, yeah.
And so I think these are the things and then that's affecting them. But also, I don't want to sound like too pessimistic. The newer generation, they are trying to breastfeed, which is a very good sign. Before it was, it was like a taboo to do that. Now it's like the pendulum is going the other side. It's like they don't even want to supplement at all, which is good. And I think everybody's here is a grandparent. Like you have seen your grandkids, right? The parents are doing, which is a good sign.
Thank you. Dr. Sarmajit, you are internist. I'd like to ask you, in your experience, what are some of the lifestyle mistakes that adults make that negatively impact their health, and how can they correct these lifestyle mistakes?
It's a great question, and a couple have been highlighted earlier. I think one of the big ones is the sedentary lifestyle. I think poor diet choices. I think chronic stress, not paying attention to people enough sleep, your mental health. Obviously, we know about factors of smoking and alcohol intake. We know about preventative medicine and making sure that adequate checkup is. But honestly, Mr. Mansuri, I think you're absolutely right. I think these are a long-term game. I think people need to make the right choices. They need to get up and move. They need to make the diet choices, not just at age 40, not just at age 50, but it's a long game. And I think adding these things, I love the point about the reliance on technology. Nobody's walking anymore. The kids don't go out to play anymore. Great point, And a lot of times you'll find as adults, we don't go to the doctor unless we have milestones. Oh, I got married in my 20s and 30s. Let me go to the doctor. Or I turned 40 or 50. But we should be going for our annual checkups and things like that.
Thank you. Dr. Syed Rahmanuddin, you are radiologist, and you are expert in cancer research. And so I'd like to ask you, how can individuals lower their risk of cancer by lifestyle change or taking preventive measures? What can somebody do to lower their risk of cancer?
Mr. Mansuri, of course, these days we have a lot of technology. It's a technology world these days. What we are looking now, technology should augment our decision. So basically lifestyle, as the other respected doctors, they mentioned. And stress is the biggest thing, which basically induce so many things. With the stress, you can be a heart patient, you can be a mental problem, you can have so many diseases. And I think the regular checkup is important. But if you talk about from my area of specialty, which is radiology, so there are a lot of things can be prevented. So in order to be kind of like a awareness program, which means if someone has a heart problem, if there is a history, they can go and do the cardiac calcium scoring. get calcium scoring, actually it helps a lot. It tells you exactly if you have any problem or not. And also these days, the whole body MRI scan is getting actually a lot of attention. That kind of another preventive technology, and actually the awareness kind of thing. And as Dr. Yasmin mentioned, mammogram is another area which basically we recommend after 35. And a lot of actually people, so basically the prevention is, early detection is the key. If we can educate the people, and if we can get them directly interact with their primary care physician and they recommend what exam they need to do, they should do it. For the virtual colonoscopy, I know people, they are worried about going to GI doctors. It's a very painful invasive procedure, but with the new technology, we simply can get the scan done, like a CT, and you can get like up 2.22 millimeter thick polyp easily. So basically, screening is key, which we need to do based on the respective diseases.
Thank you so much. So back to you, Dr. Yasmin Qasim. How can people better understand and act upon the diagnostic results to proactively manage their health?
According to the United States Health Services and Agency, they recommend that 30 minutes or 20 minutes of physical activity every day. And that activity, you can do walking, you can do dancing, you can do swimming. But physical activity is very important to, for your health. The other thing is nutrition. You eat better, low cholesterol, ये junk food कम खाएं, बच्चे भी और बड़े भी. And I mean, I'm just
I won't get
come
to
back
eat at
into
all.
the
Okay.
So first thing is physical activity. The second thing, you watch your nutrition, what you're eating, your carbs and everything. And the third thing is mental health. Mental health is very important. You don't need to stress out with your stuff. Relax. Have 6 to 7 hours or 6 to 8 hours regular sleep, which will provide you energy to work the next day. The other thing is you can do yoga to relax yourself, but you have to be relaxed and mentally able to perform your duties next day. So don't stress out. So I think the main emphasis
don't
you have
overdo
to
it.
do is nutrition. Watch your diet, what you're eating, your physical activity, your mental health. If you take care of these things, you will be living healthy. Keep following up your stuff. As I said, mammogram important. There is a fit test is a test that fecal immunological test, which is non-invasive, that diagnose your occult blood in your stool, and it's early detection of colon cancer. You need to do fit tests, you do your pap smears regularly. They recommend the girls in the age of starting 21, sexually active, they should do their pap smears to rule out cervical carcinoma.
So how often or at what age one should start getting very regular screenings done, and how often do you're supposed to get the A1C, cholesterol, and other tests?
Every 3 months, you do hemoglobin A1C to see what your blood sugar level is, or how your blood sugar is doing. It's very important. And for cholesterol also, you have to do every 3 months. If you do your regular doctor visit with these checkups, you will be a healthy human being. Otherwise, and if you don't pay attention to what you're eating, what your physical activity, like sitting in front of the computer, like Dr. Shahabuddin was saying, that the kids nowadays just sit in front of the computer and working, no physical activity. They don't go out, they don't play, they don't do anything.
Yeah, you had a lot of activity back then because there was not the technology that we have today. So yes, technology is good, and also it has these side effects as well. And thank you so much. Dr. Shahabuddin, I would like to ask you what the parents should focus on, some of the key factors the parents should focus on to ensure that their kids grow up healthy, not only physically but also mentally?
Like Dr. Yasmin Qasim was saying that, regular checkups. In pediatrics too, we do have regular checkups. Usually it's annually after 2 years of age. And the American Academy of Pediatrics has the cholesterol screening between 9 to 11 years of age and after 17 years of age. And we usually do not do the hemoglobin A1C or all those detailed tests unless if because of the childhood obesity we have started doing that. We usually do it as needed but not regularly. If the child is overweight, then we go ahead and do it. Otherwise, we don't do it. And then, of course, more family centered living conditions. The parents are busy, we know that, but then have time in the evening. At least one meal should be with the whole family. And also, to see how the kids are doing in school, because that also affects their mental health. And with the bullying going on, you don't even know what is happening with the social media until that affects their mental health, which also can make their symptoms worse. And now, of course, the physical activity that you have to do. The AAP says 60 minutes every day, and like Dr. Qasim was saying, any activity that the kids like to do, go ahead and try to do those things, and then try to avoid fast food as much as you can. I know it's hard with the economy, the way things are. It's not easy. Everybody, and because both parents are working, and then they come home in the evening, everyone is tired and they just want to go through. But it is hard, but it is doable. And also try to avoid the phone use the phone in the evening after 6 o'clock, because that affects their sleep pattern for the kids. So instead of having them on the phone or the TV, have them read a book. That will help them come.
Dr. Azhar Majid, what are some of the simple dietary changes one can make to, improve their immune system and resilience and overall health?
So excellent question. You probably need a whole program just for dietary. But I think this resurgence of back to basics, cutting out processed food. If all of us look in our pantry, natural stuff, natural fruits, vegetables on the counter, And you're absolutely right. Today's world, everybody is working, kids are going to school. We're trying to get the pre-made stuff, the protein bars, this, that, but we're not taking in enough. So remember your plate as a whole. The more colorful it is, the healthier it is for you. Okay? So you want to see a lot of color on your food plate, fruits, vegetables, things like that. But I think all of the things said by the panelists all incorporate that. The kids come back from school. You're absolutely right. They're hooked on their phones and computers. They're not out with their activity. On top of that, in order for transportation and comfort, we're relying too much on processed foods, and the kids don't take their lunch anymore to school. Sometimes, everyone is doing this. It's such a broad question, but I think the essence of it is, Mr. Mansuri, is simplify your diet in moderation with natural stuff. Get rid of the processed foods. Are you eating your daily allotment of fruits and vegetables? Lean proteins, right? Hydration. I'll give you a simple example. In one of my patients, diabetic and a heavy overweight patient, we analyzed his diet. He was drinking 1 to 2 cans of Coca-Cola a day. 1 to 2 cans. Lunch, he works, a big company. I told him to do the math with me. We stopped 2 cans of soda a day, 90 grams of sugar a day, almost 400 calories decreased. The gentleman lost 1.5 pounds a week, Mr. Mansuri, and you can do the math.
That is incredible.
Just from
such a simple.
Your question of diet is of utmost importance. So, thank you.
Very good. Thank you so much for sharing that. And Dr. Syed Rahmanuddin, I would like to ask you, what are some of the recent advancements in cancer research that are very exciting? as far as the prevention or detection of cancer?
So it's a good question. Uh, I definitely wanted to start with the pharmaceutical companies. They are investing billions of dollars. They are doing so many clinical trials. And when you talk about the therapy, and then we talk about the innovation. So mostly innovation these days, what we are doing is based on immunotherapy. Still, we are facing a lot of challenges on immunotherapy. But AI is taking the lead on a lot of these things. What AI is doing, AI is not replacing, again, let me repeat it, AI augmenting our physicians. AI giving us a tool, which means if we use the AI common, like in a common routine practice, then we cannot miss the disease. The problem with the cancer, the problem with the disease, if we miss it, we miss it. When the patient comes, like Dr. Majid is in the clinic, he doesn't have much time. When the patient comes, the next time the patient is going to come after 3 or 4 months, and then he has tons of patients. So we just wanted to make sure patient recover all the everything. So AI is actually what it's doing is actually gathering all the data, consolidating all the information. This is what is happening in radiology too. When we finish the scan, for each person it take like a regular exam like 20 minutes to read, but what AI is doing, you just simply, and in fact the Elon Musk, he just started the same technology, and we have several other folks actually, they are working on it. So simply patient come and we just upload the images and the system will read the entire scan. And exactly the similar thing, what is happening now when we get the report, it tells us exactly how much, where the problem is. Let's say for the smoking and for the lung cancer screening. These things very important these days. We live in a world where we eat a lot of junk food. We have a lot of exposure, which is the radiation exposure everywhere. So what we need, in fact, we need to make sure when we are doing a lung cancer screening or we are doing a smoking cessation, we just simply go and check actually if there is any chances or if there is any family history.
Thank you so much. Dr. Azamjeet.
Excellent points by all the panelists, and I think we've covered a whole range of things. But if I would to answer your question as the takeaway, and I would say it's let's get rid of the sedentary lifestyle. I think people need to get up and move a little bit. I'm not advocating everyone to go run marathons, but I think, Dr. Halima mentioned it and the other panelists, we're just not getting up and moving. And, recently studies have shown that those people in the middle age or younger age who aren't as moving, their long-term effects post age 65 are severe arthritis, hip and knee issues, and it's all because of movement. If you look at some of the people well into their 90s and who have the least amount of, for example, orthopedic or other issues, the number one key factor in all those people was mobility. They were walking all the time. And I think that is very simple. Mental health, I want to applaud Doctor for mentioning that because I think it's on a back burner too. But I would say as the new, we've all heard it and seen the poster, sitting is the new smoking. You've heard that, right? And I think that is really key. Even if it's just something simple, whether it be going out in your backyard, doing something. Hey, I tell my patients, can you even walk to your mailbox? And they'll tell me, I don't even walk to the mailbox. Get off, the couch, and let's do that. Everyone can do it at any age. In fact, recently I read something so interesting. There was a study in England. They showed people who had never exercised in over 25 or 50 years. They've never moved except for getting up, right? It takes them just a few months of simple steps and they can drastically improve movement. So it's never too late to get up and move. That would be my thing.
That's really good. That's good advice. Thank you so much. Dr. Halima Shahabuddin.
I'm a pediatrician, so the one thing that I would definitely want to go ahead and increase is the vaccine hesitancy. It's a new thing that has been going on, and it's the new parents, they don't want to get their kids vaccinated. And the reason I think is because those young parents, they have not seen the diseases because we were so good at giving the vaccines and their parents were so good at getting them vaccinated. They have not seen the disease. So if you don't see it, they don't want to get it done. And so we have to plead to them to get, because those diseases are really scary and life-changing diseases like polio and hepatitis and tetanus and all that. So we have to plead with them to at least get one vaccine, one at a time, because I think there was in the social media thing that one time it causes autism with the measles vaccine. So that just snowballed into all the vaccines not being, the parents are not, now they don't want to get any other vaccines, but so now you have seen the measles outbreak that you read, that when they go from outside and bring it, and they rely on herd immunity and all that, but that's not going to last forever. It's going to change. So definitely, if however they want to go ahead and do it, go ahead and get started, because you don't want those bad diseases for your kids.
Thank you so much. Dr. Qasim.
Well, Mr. Mansuri, I think I can sum up all of these physician recommendations that for doing all this thing, the person has to go regularly for your doctor checkup, because they think, oh, I'm fine, I don't need to do anything. Mm-hmm. No, you're fine, but still you need to go doctor and check up regularly to see what problem you have, blood sugar, cholesterol, heart disease, diabetes, thyroid problems, whatever. So my recommendation to every person is to regularly go for your doctor visit. Don't say, no, I'm perfectly fine, I don't need to see any doctor. Mm-hmm. It's not like that. You have to see a doctor just because to get all done. All these tests and all the physicians are here to help them out, whatever their diagnostic test shows. So my recommendation, go to your doctor for your regular checkup.
Thank you so much. I would really like to thank you all for joining us today for this insightful discussion on living well, tips for a healthy life. And I would really like to express my deepest gratitude for my distinguished panelists for sharing their expertise and valuable advice with us. For my viewers, I would like to say that, small steps but consistent steps towards a healthier life can make a big impact, whether it's healthy nutrition, activity, or regular screening. Please prioritize your health. Thank you so much for watching The Mansuri Show. Please keep sending us your feedback at the address on your screen. That's all the time we have. Till the next time, please stay safe, stay healthy, and be well. Khuda Hafiz.
Parents, show your love with Tahir Halal Kids Multivitamin Gummies, made in the USA and certified halal. Delicious and packed with essential vitamins, these gummies keep your little ones healthy, happy, and full of energy. No fuss, just fun, because good health should taste great. Tahir Halal. Love, nutrition, and care in every bite.
ताहिर प्रोडक्ट्स आपके खानदान की सेहत के लिए बेहतरीन हलाल विटामिन्स और सप्लीमेंट्स खालिस, मियारी और फखर के साथ अमेरिका में तैयार करदा।
Kaba Fusion is a pharmacist-owned, patient-focused team of professionals with over 30 years' experience providing intravenous medication to patients in the comfort of their own home. Founded by Dr. Sohail Masood, Kaba Fusion has 7 state-of-the-art pharmacies located across the country. Visit us at kabafusion.com to learn more about the benefits of in-home infusion therapy.